Okay, we're good.
Well, good afternoon, everyone. I'm Mayor Hardy Davis of the city of Augusta, Georgia. And tonight we have some outstanding medical professionals who are joining us to share a conversation, our first of a series of COVID-19 conversations, particularly in light of the fact that the pandemic continues to ravage not just America, but across this globe. We see a surge in cases. But we're very fortunate now. We see light at the end of the tunnel, as I heard earlier today, because the first series of vaccines have been made available and are arriving in communities all across this nation. 145 communities, in fact. And so tonight, while we look forward to having this conversation, the first vaccines landed in New York City this morning at the Jewish Medical Center in Queens. We still yet cannot lose sight of the fact that COVID-19 is still a real and present danger to those of us in our communities across this nation, and certainly here in Augusta, Georgia, where most recently we too have seen an uptick in cases, which still yet concerns us. And so tonight, when we look at our local community numbers, we realize that we must remain vigilant. We cannot take our foot off of the gas at this point. It's still important for every one of us as citizens in the city of Augusta to do the 3 W's. We must continue to wear a mask daily. We must wash our hands regularly at a minimum of 20 seconds. And we must continue to socially or physically distance when we're in communities. And that's important for us if we want to get to the other side of COVID-19. Based on recent data from the Georgia Department of Public Health, Richmond County has seen confirmed cases totaling 10,878 since the beginning of this pandemic, with 203 confirmed deaths. As I've shared throughout the course of our time, beginning in March when we issued the first executive order prior to the initial shutdown in our city, these are not just numbers. These are family members. These are loved ones. These are friends. These are coworkers. These are individuals who have lost their lives to an enemy that we could not see, that we did not anticipate, that now is still yet amongst us. We also, to date, have had 794 hospitalizations. One case is too many when we understand and recognize that this could have been prevented in terms of the outbreak in America, with some 15 million plus cases, and we've already approached over 300,000 deaths in the United States of America. And so as we enter this conversation on tonight, there are a few things that we know to be true. One, that Georgia's testing rates have significantly declined, making it difficult to interpret the current state of this pandemic. In the most recent White House Coronavirus Task Force report, we find ourselves back in the red zone in Augusta, Georgia. No longer in the yellow zone, but in the red zone. We also know that Georgia must increase its surveillance for silent community spread by identifying younger individuals with asymptomatic, mild, and pre-symptomatic infections. This is extremely important for us tonight, which is why I couldn't be more proud than to have the panelists that we have joining us on tonight. And so I will share the final thought, and that is exposure to asymptomatic cases, seemingly uninfected family members and friends who may be infected but asymptomatic, is of great concern to us as well. I'm going to pause here tonight and bring to the forefront our panelists. We're incredibly excited to have with us, joining us from Meharry Medical Institute College that many of us are familiar with. We have Dr. Vladimir Bertrode. We have Dr. Rabir Singh, both representing Meharry Medical College. We have locally Dr. Ronald Brown, Jr., gastroenterologist and a member of the university healthcare system. And hopefully joining us later will be Dr. Stacy Davis, a pediatrician, also representing not only private practice, but the university healthcare system as well. And so with that, I'd like to take a brief moment and allow them to introduce themselves directly, and then we'll get into our time of question and answer and have a robust conversation. We'll begin with Dr. Bertreau.
Thank you, Mayor Davis, for inviting us to join your panel and to give us this opportunity to talk to the people of Augusta, Georgia, and surrounding counties. And it's a pleasure to share our expertise and experience with you. I'm a physician by training. I specialize in infectious disease. My particular focus is on HIV, tuberculosis, hepatitis, and STD. And now since March, I have a new interest in coronavirus. And then one of the things I have to mention that especially with Augusta, Georgia, so in October, we published a paper to ring the alarm on rural counties for the coronavirus. We raised the alarm about geographic disparities. So you have to, that's why I'm glad you mentioned that the counties surrounding Augusta are in red now. So at the same time, I hope that the resources that you have at your disposal will match the needs of your community, because quite often rural communities, small cities, small towns, they are very neglected. They are way behind the line when it comes to allocation of resources, whether it's PPE, medication, ventilators, and we don't want that to happen with the coronavirus vaccine.
Thank you. Dr. Singh.
My name is Rajbir Singh, and I'm a physician by training as well. I'm a director of Clinical and Translational Research Center and faculty member in internal medicine. And I agree with Dr. Bertreau that we need to take or divert all our resources towards the people who are at the end of receiving. There are disparity we need to address, and the people who are in need of these things, our resources should go first to those people. Thank you.
Thank you. Dr. Brown.
Thank you, Mayor, for this opportunity to participate in this panel discussion. I'm a practicing gastroenterologist, internal medicine in this area now for over 30 years, internal medicine and gastroenterology. And I think this is important because make no doubt about it, COVID-19 is a pandemic. It is everywhere. And I believe that if we know better, we're bound to do better. And as a person of color, I think it's important that we pass out information to the public so that we can be better prepared to protect others and ourselves during this dangerous, dark time.
Thank you. Thank you. And so tonight we begin our conversation, again, the first of a series of COVID-19 conversations of this nature. And while it is a much needed conversation, the challenges that face us are diverse. It is one, having access, equal access to the deployment of the vaccine in all communities, but without question, as we've heard earlier today, concerns around COVID-19 vaccines being deployed in communities of color that have been disproportionately affected by COVID-19, not just in Augusta, but across this great state and, more importantly, the nation. And so tonight, we want to assure that Augusta and beyond individuals are able to have a better understanding of, one, the COVID-19 virus, the novel coronavirus itself, as well as what the vaccine means, how people will receive that vaccine, wanting to ensure that while we've seen a disproportionate impact that COVID has had in communities of color, how do we move beyond that place while at the same time dealing with the challenges of the historic implications of new vaccines being administered in communities of color, the inherent concerns, the fears, and sometimes the frustrations. And so we want to lean into that to some level on tonight. And I want to pose this first question for either Dr. Singh or Dr. Bertraud, and that is, with the name Operation Warp Speed, we understand that the vaccines were delivered at record pace, and they requested the manufacturers, both Moderna and Pfizer, did something that generally we were seeing unusual. They requested FDA emergency authorization because of the sheer magnitude of the pandemic and the need to have a solution. So can you both, or either one of you, speak to the issues or the challenges that people may have or concerns around these vaccines did not go through the normal timeline in terms of testing and deployment? Can you speak to that? Do clinical trials results show whether the vaccines are effective?
Yeah, so this is the major breakdown in communication. And the term warp speed would apply to more so to military operation. But SMID has more to do with science than to politics or military. We have to understand the technology that we applied to develop those vaccines has been there for the past 17 years. So, and I'm fortunate to know the person who developed that technology for the mRNA vaccines at the NIH. So he's been working all his life on getting to an HIV vaccine. And when the coronavirus came out, so that was a great opportunity to apply this technology. And many of those sponsors are using the same technology, the mRNA technology. The mRNA technology is very, very rapid. It progresses at a rapid speed. So if we apply the warp speed to the technology, that's quite correct. Usually, when we do a vaccine trials, it takes 5-10 years. It takes 5-10 years. There are specific reasons for that. One is money, and two is the number of participants you have to recruit in these trials. Most vaccine trials enroll between 5,000 and 8,000 patients, 8,000 participants over this 5-10 year period. Now, which is unprecedented, that's under the warp speed that applies to government. So those trials enroll larger number of participants, 30,000, 40,000 in the span of a few months. Why were they able to do that? Because there was a positive collusion, if I may say so, between private and public entities. And the money was there, not only in the United States, but also in Europe, in China, Russia. Okay, so the science was there, technology was there to produce those vaccines at a rapid speed. And when the money is there, so you can enroll a large number of participants, as you've seen here, in a very short time period. So now the next question you're going to ask, so after enrolling this participant in such a short time period, so will you be able to show that the vaccine works? It depends on what you're trying to show, okay? So what they were trying to show after 2 weeks is to show safety and efficacy after 4 weeks of follow-up. For most vaccines, you see the side effects during the first days, actually. And rarely you see side effects beyond 4 weeks. That's 99% of the cases, okay? And then what they were looking at in this trial, they were looking at coronavirus disease to see if the vaccine protects against coronavirus disease. So they had enough time to see that outcome. And more important, they had enough participants to say that show that the data is very solid. So warp speed, while it applies well to military operations, but at the same time, it really applies to enrollment time in this vaccine trial and the turnaround speed of this technology. So, but people have to explain it better. So it's not like because unfortunately, we have to say President Trump linked this warp speed to some specific deadline that was associated with the election deadline. So that was wrong. So they didn't bypass any vaccine steps. So they went to all the steps from phase 1, just testing for safety, from phase 2, testing for a specific dose, and the phase 3, testing in the large number of patients, subjects. The main reason why most vaccine trials have to take time, because most of the pharmaceutical companies, I mean, they are for-profit organizations. They have to raise money. And so their shareholders have to agree that this vaccine research has to continue. They have to raise money. It takes time for them to raise money. So that's the main reason. Not for warp speed, the money was already there. 10.5 billion that the United States government put toward this effort.
That's fantastic. Dr. Singh, would you like to add anything to that?
No, Dr. Beto explained it very well. I would just like to say that, what Dr. Beto just said, that all 3 phases were completed, like they were ongoing also. The participants are still being followed. It's not that something is missed. The science behind all 3 phases, showing safety, efficacy, and, is very strong. And because this pandemic, there were so many patients or so many subjects getting infected. So when you enroll so many patients, what you look at is that to compare the patients who were in a placebo group versus the patient who received the vaccine. When placebo group patients get the disease, or the patient who got the vaccine gets the disease, you see whether vaccine was effective or not, right? So since there's widespread infection, they had enough patients who got the disease in placebo group and also in vaccine group. In the vaccine group, those who got it, their symptoms were much lower and they had much milder form of infection as compared to the ones who were in placebo group. So even though it was faster, but they got the endpoints, they got the enough data to show that it is safe and effective. So that's what I wanted to add to what Dr. Beto said.
Fantastic. Let me ask this follow-up question, and we have a series of other questions that are coming in through the chat line at this point. But for laymen, for lay people, for the everyday citizen that's out there, they're experiencing COVID fatigue. You've got all of these challenges, and now you hear that there are 2, possibly 3 vaccines that are going to be made available to the public. And I start hearing these medical terms, placebo group, regular group. Help us understand the difference between the placebo group that was tested and the regular group that was tested.
Okay, so what you call the regular group is the participants who receive the vaccine. The placebo group is a group of participants who receive something that looks like the vaccine, but it's not the vaccine. But the participant didn't know what they received. And then the investigators who were conducting those trials, they didn't know what was given to any of those participants. So that's how that's what they call the gold standard of a clinical trials. That's what we call the randomized clinical trials, okay? So when the participant signed for the study, So it's by random that they are assigned to one of those two groups. Okay, it's by random, just by chance that they are assigned to this particular group. So now, in statistical term, we always say that if you want to look for what they call efficacy, the placebo study is the gold standard. Okay, the placebo study, if you go standard, the placebo study can show you a more what we call the magnitude, the size of the effect, than comparing two drugs or two vaccines. So they use a gold standard in clinical research to conduct these vaccine trials. So that's what make us confident. So the science is very rigorous. And at the same time, also what's very important, people don't just run these trials blindly. Safety is of utmost interest. There is a separate group called Data and Safety Monitoring Board that watch the trial from time to time. Every 2 weeks, they review the data to look for signal in terms of safety or efficacy, to see if something wrong is happening in terms of side effects. They may have to stop the trial for a while. Or they want to look at whether or not the trial is working. If it's not working, if it's projected not to work, they can stop the trial. And if they see that the data shows clear evidence that the intervention, in this case, which is the vaccine, is working well, is beneficial, they can say, okay, either you continue, okay, or we can stop because we have enough data. We have enough data to satisfy the question that we ask in the trial.
Fantastic. Dr. Vertrote, thank you for that. I'm going to come to Dr. Brown, but before I do that, I want to acknowledge joining us is Dr. Stacy Davis, our pediatrician from University Healthcare System. Dr. Davis, thank you so much for joining us, and we'll come back to you in just a moment. Dr. Brown.
Thank you, Mayor. One of the first things I wanted to say is Dr. Ronald Brown Sr. is a lot more informed than me. I am Dr. Ronald Brown Sr. But let me also mention that from the community standpoint, safety is paramount. And maybe our other two participants can also mention the fact that I believe because this is an mRNA-derived vaccine, which means unlike some of the other viruses in the past, it's not a live or an attenuated or weakened virus that has created this vaccine. So in other words, the possibility of developing COVID from receiving the vaccine is practically nil. So that's one of the factors that make this such a safe, one of the safer vaccines from the onset.
Mm-hmm. Exactly.
Dr. Singh, you want to speak to that?
No, exactly. That's a very, very important point for the community stand-up.
One more thing in terms of safety of the mRNA vaccine also, it does not change your genetic makeup because it does not go into the nucleus where your DNA is located. It goes only into the cytoplasm, the liquids around the nucleus, and it got practically once it does its mission, which is to encode for the protein, it goes away right away. So it's not in your body. It's nowhere in your body. So that's why nobody can get COVID vaccine from an mRNA vaccine. It's totally impossible.
Fantastic. So let's do this. We have a host of questions, and I'm really pleased that the public has weighed in on this. Dr. Stacy Davis, if you would just give us an introduction of who you are and your practice area.
Good evening, everyone. Sorry about the late joining. You know, when you have young kids, you have to run around and get them situated and around at the hospitals and everything. But once again, I'm Dr. Stacey Davis, pediatrics here in private practice in Augusta. I do have medical staff privileges at University Hospital and Doctors Hospital in Augusta, but my base is community practice right here in the CRSRA. So just to be able to be a part of this forum, to hear information that I can in turn share with the parents of my patients is very helpful.
Wonderful. So we have a series of questions. I'm going to pose these as we come, and certainly we will definitely be leaning into the issues around communities of color and the inherent disparities, as well as concerns about the vaccine. Both Dr. Singh and Dr. Bertrode have leaned into that just somewhat to just echo that this is a very safe vaccine. There's been phenomenal testing that has been done in phase 1, 2, and 3 that brings us to this. So safety and efficacy have been done in ways that over that traditional 5-year period of time, you would not have seen this number of individuals who were included in the trials. So with that, we have a question from Kevin Peoples. We have a question from Carolyn McCrae. We have a question from William Hicks, and then of course from Miguel Lagoas. I'll ask the questions in this order. And I pose this to all of you. How would the doctors address the latest polls expressing concern that minority communities have regarding taking the vaccine? How do we take steps to inform, to empower, and educate communities of color so that they feel confident in taking this vaccine?
Having seen myself the results of the vaccine trials at the FDA meeting last week, I would say they have good reasons to be concerned. For example, the Pfizer trials enroll in 10% of the participants were African Americans in the United States and globally, only 10%. So people didn't have a very good representation in the Pfizer trial. But for the NIH trial, which what they call the Moderna trial, the participation was much higher. I don't remember the exact number, but it was much higher than 13%, which is the proportion of African American in this population. They were well represented, and so were elderly, a large proportion of elderly actually in both trials. So in terms of representation, I would say for the Moderna trial, African Americans were well represented. Not so in the Pfizer trial.
With that being said, Dr. Bertrode, as we get to the point of the Pfizer trials, more importantly, the vaccine being made available across America, it was the first to receive FDA emergency authorization. There's expectation that the Moderna vaccine will receive that similar authorization this week. What message do we send to communities of color as those vaccines are being made available into the communities?
I have seen the preliminary results of the Moderna trial, and I can tell you the side effects were similar across all ethnic groups. And actually, in terms of age, and it seems that the elderly tolerated the vaccine better than younger individuals. So, we'll have more trials, and the ethnic mix for those trials might be different. So we have to reflect on each trial as on its own merit. So given those two vaccines that are going, one is already available and the other one might be available this week, we can say that if we look at what they call in science biological plausibility, so you say, okay, given what we see in this trial, can we extrapolate to other groups that did not have a good representation? I would say yes. And another extrapolation that was made for the Pfizer trial, for example, most of the participants were 18 years and older. There were a very, very small number of people age 16 and 17, but they still recommended the vaccines to people from age 16 and up, because the overwhelming majority of the group of experts feel confidently that the vaccine will be safe and effective in this group of 16 and 17. But at the same time, Pfizer will continue to enroll people in younger age group. I think they're going down to 12 years old, I believe. So not having a sizable representation does not necessarily mean you cannot extrapolate to that specific group based on what we call biological plausibility. And that's being done all the time for vaccines and for drugs as well.
Thank you. I want to go to Dr. Davis. Dr. Davis, and certainly to the rest of the participants. Can you speak to, Dr. Davis, in your experiences? How has COVID-19 affected children in our community? What are the signs and the symptoms that parents should look for in their children that may point towards the need to have children tested and evaluated by healthcare professionals for COVID-19?
Sure. COVID symptoms, I think, as we learned more and more from about March up until now, the symptoms have shifted, and even I think in the pediatric population, initially we were saying, okay, check for fever. But then as we started realizing and recognizing that you can have asymptomatic people that may not have fever, then we had to look at some other symptoms. In children, sometimes sore throat. I've heard some to say backaches, stomach aches, but the symptoms are just really vague. So I had to really rely on asking the questions about kind of doing more contact tracing. Who have you been around? Has anyone in your household been sick, had symptoms, been tested? Because in the pediatric population, they're either going to school or they're in a household of parents that had to work or go into work. And so I would have to lead off by asking, has anyone that you've been in contact with had a positive test? Because the symptoms were very, very vague in pediatrics. But once again, some of those symptoms, backache, sore throat. I didn't have a lot that complained of the loss of smell or taste, sprinkling here and there. So I think we really had to rely on, like we have to do in pediatrics, is just really asking those questions, any known contact or anyone in school, and then go ahead and send them off for testing. Here, December 2020, I think the large portion of it is going to be if you have a suspicion that you potentially were exposed, then let's go ahead and get you tested. The younger babies, I've had maybe in my population a handful that tested positive, but none of those babies had to be admitted in the hospital. I think that they were tested because of someone in the household that was positive, maybe a fussy baby or so. And they tested positive. They, just did close observation, but none of my patients, young infants, had to be admitted or had to receive medication.
Thank you. Dr. Brown?
Yes, thank you, Mayor. Just to go back to the previous question, in that for our community, we need to know, as I've said, that this virus is universal. I mean, even my own family, 2 of my cousins less than 50 years of age have died to COVID. I have a 70-year-old who is in a nursing home recovering now from COVID. So we have to know that this disease is real. And so what we have to do is understand as a community of folks, we looking and thinking and remembering the Tuskegee study where African Americans were just given live virus without their permission, probably behind closed doors. This COVID virus vaccine is a lot different. I believe it's already been administered in Britain, where under a lot of this is open to the public. I believe that some of our leaders have already committed. Certainly Dr. Fauci is committed to doing it receiving it on TV. President Obama, Clinton, and I think President Bush have all committed to doing this. So this is an open, it's very apparent, and we don't have to have the concerns and the worry that we've had in the past regarding medicines that have been administered behind closed doors, if you will. Our leaders of color are coming forward saying that this is a safe and very efficacious vaccine. So I think that goes a long ways in helping the public and to understand the seriousness of this and the safety of this vaccine.
Thank you, Doug.
And
Yes, Dr. Davis, go ahead.
And
Yes,
actually,
please.
to piggyback on that with what Dr. Brown is saying, I think if we are transparent with the community and then let them know that people of color are researchers that are a part of this task force working with that vaccine as well, letting them know, putting it out there to say that, hey, we are a part of this research and looking into this particular vaccine and highly promoting it.
I think that's fantastic. And it certainly goes a long way in terms of dispelling the fears around taking this vaccine. Again, Dr. Brown mentioned the Tuskegee experiment and the historical implications associated with that. That is why we're bringing tonight's conversation to our community. And we will have subsequent conversations with the goal of, again, informing, educating, and empowering our community and, quite frankly, this region so that we not only can continue to fight this pandemic, but to know that at the point in time that the vaccinations arrive in Augusta, Georgia, we're anticipating that those first wave of vaccinations will arrive in the community later this week, if not later this week, certainly the week of the 20th of December. We're anticipating that. As I said earlier in our conversation, the first deployment of those vaccinations arrived today in the coastal Georgia area, Greene County, Chatham County. And as we make our way into East Central Georgia, Middle Georgia, and of course, Metro Atlanta, we look forward to communicating broadly to the general public about where the vaccinations are available at and working closely with our broader community and stakeholders to ensure that people know. With that being said, I do want to just lean into just once more the issues around concerns that people have. And I pose this to each of you as our panelists, that in a recent Pew Research poll, Latinos, 40% of Latinos told Pew Research that they would probably or definitely not get the vaccine. More than half of Black respondents said the same thing. Their sentiments were, they think they will get COVID-19 from the vaccine and die. How do we address this fear? Let me go to Dr. Singh first, and then come back to you, Dr. Bertraud. Dr. Singh.
Yeah. So yeah, that is the most important question, and that's a fear everybody, not only communities of color, but as you mentioned, Latinx communities and other communities also have. Whenever they are trying to enroll themselves into a clinical trial, specifically, they want to know exactly what is the product, how is it going to affect their body. especially for vaccine, there is so much of skepticism, there is so much of falsehood spread in the past by anti-vaxxers, and some studies, bogus studies saying that, there's autism linked to vaccines, and then, you can get the disease from the vaccines. That is all false, and it's been proven false, and those investigators are actually not longer working, and their licenses were suspended. Right. And now coming back to how do you instill that trust is, I would say that there is an informed consent, which was never there in the past, and you educate them uh, everything about the vaccine, that this is a vaccine where there is no live or killed part of the virus. It is product made in the laboratory, and the data which is shown by the current trials is very safe and effective. And even though there is less percentage of participants from African American community in Pfizer trial, 10% or so, as Dr. Beto said, and much more in Moderna, that is still way higher than the current, or any other trial, any other trials participation from African American community. So the safety shows, and the trust will build up with proper education and information. That's and once you have that, they will make the informed decision.
Thank you.
I think one thing we have to tell people upfront is that there is a lot that we don't know about this vaccine and about coronavirus in general. What we don't know about this vaccine, we don't know if it prevents transmission. We don't know how long immunity will last. We don't know the efficacy in pregnant women, in children. So we don't know those things. And then there's a lot we don't know about the disease itself. We still don't know all the clinical manifestations. For example, like the symptoms that we see in young children, what they call the multi-inflammatory syndrome. This is something we noticed in May. The loss of taste, smell, those are things that came later. Gastrointestinal manifestations, they appeared later on. So I'm sure that there will still more to learn. The other thing I'm very concerned. While we don't know a lot, we have to tell people that what we know now in terms of data is solid. In terms of science, it's very good science. And in terms of study protocol, we follow the rigorous study protocol. That helps us build confidence in the vaccine. That's what we have to know. As the studies are continuing, even if they receive an emergency use authorization, all the vaccine studies, they are continuing for another 2 years. We will gather more data, more information, and then we'll come back to them and explain what we find, if there's anything new. So we will learn more as those studies are being implemented. But we have to be very careful. I'm concerned that people like African Americans, Latinx, who really need to get protected against coronavirus, like Malcolm will say, by all means necessary. Okay, the vaccine is the more powerful means right now. So I'm concerned, one, about allocation, and two, about missed opportunity. Because if you have too many people in the African American, the Latinx community who are not vaccinated against coronavirus, their risk of exposure will be magnified. as compared to the previous surges. Their risk will be magnified. Remember, this is an ongoing epidemic. We may have another surge next month and until the spring. So I'm concerned about having a magnified risk of exposure in those communities who are not taking the vaccine. And then the disparities will just be also magnified. And not only in terms of health disparities, but also in terms of economic downfall. Because if you're sick, you cannot work.
So Dr. Petrou and the rest of our panelists, let's shift our conversation just a bit. We've talked about concerns about communities of color taking the virus. We've talked about the safety and efficacy of the virus. We've had some brief discussion as it relates to children and what we should be looking for, even with the understanding that because of the, I guess, uniqueness of COVID-19 and the symptoms that may or may not show in whether it's children or those 18 to 29 individuals who are completely asymptomatic as well, or pre-symptomatic individuals. As we shift, let me pose this question. We have been told that both vaccinations, Pfizer's and Moderna's, requires 2 shots. Can you speak to the issue of why 2 shots, and will there be sufficient enough vaccinations for people over that period of time that's required to get those 2 shots?
The reason is very simple. The second shot boosts the immune system. You have a much greater immune response after the second shot. So we don't have data for 1-shot vaccination. So people should refrain from taking just 1 shot, because the studies right now, those 2 vaccines are approved for 2 shots. Taking 1 shot is not the way to go. We have to take both shots.
And how quickly between shots are they to be taken?
21 days apart.
Okay. And our next question, 2 shots within a 21-day period of time. As we move into the winter season, knowing that we will have just a number of doses available between today and the end of December, and then flu season is upon us as well. What message do we share with the general public about the differences between getting the vaccine for COVID-19 and the flu? What do we need to be telling people?
We can say that right now, more people in the United States are dying of coronavirus than the flu. More people. If you have to choose your priority, it should be the coronavirus vaccine. And then you can take your flu shot later on.
Okay.
Also, you just need to maintain a certain gap between the 2 vaccines. It's not that you take one and you can't take the other. I just want to mention that they can take both, but you just need to follow the instructions of the physicians how to take both.
Okay, can you speak to that just a little bit broadly, Dr. Singh, that you certainly can take both vaccinations, but the flu vaccine and the COVID-19 vaccine, but there clearly needs to be some distance between the application of both.
So they're just trying to make sure that the vaccine interval is like kind of far apart, that they don't interact, the symptoms don't, because there is no clear-cut data how they will behave if they are within certain period of time. They're just maintaining that gap so that there are no overlap.
Another very important thing to remember, even if you had the coronavirus, you can take the vaccine, but you have to wait for 90 days before you take the coronavirus, even if you had coronavirus.
Okay, that's helpful. Here's my next question, and I pose this primarily to Dr. Stacey Davis. A question from the public: where can children go for COVID-19 testing? What locations, and what are your recommendations for children across age groups?
Okay, well, thank you for the question. In the CSRA, there are different testing sites, and it actually has opened up better for getting children tested than early on with the pandemic. So really, now the testing center, AU, Augusta Health Center, for those locals or who have been originally from Augusta. I still like to say Medical College of Georgia because you can get confused with University Hospital here in our area. But the AU Health Center, Medical College of Georgia, there is a testing site and there is a hotline number as well. I don't have that here with me now. And then even out in Columbia County at the health department there, you can get tested. And then the MedNow centers in Augusta, which are some of the urgent care centers, you can have your children tested. So Warren, I don't know if whoever posed that question, they're exactly right. Early on, it was very difficult to have children tested, but now it has really opened up, especially because they're trying to keep the schools in the different counties opened as they have more cases that they're doing contact tracing with. So they can start with AU Health Medical Center, your health departments within your counties, and then MedNow urgent care centers as well.
Okay, thank you for that. I know we are approaching time certain that we were going to host this conversation. I would like to, for the benefit of our viewers, take just maybe one or two more questions. And I'll pose this to our doctors from Meharry. And the question that's being posed from a viewer is one of the COVID-19 vaccines expected to be more effective for the elderly population?
We don't know that because there is no comparative study looking at that. So we don't know that right now.
Fantastic.
But
Thank you.
you can say that in terms of side effects, it seems that elderly participants had less side effects compared to younger individuals.
What are the side effects, Dr. Bertraud?
Most of the side effects are the same that we have when you take your annual flu shot. You get a little pain in the arm where they inject the vaccine. You may get some redness there, some malaise, some fever. And then they usually go away in 1 or 2 days. Rarely they will stay beyond 3 days. Those are the most common side effects. And it's extremely rare for someone to develop side effects after beyond 2 months. It's extremely, extremely rare. Oh.
Okay. Let me share this to our viewing audience that AU's Augusta University's COVID hotline number is 706-721-1852. Again, that's Augusta University Health's COVID hotline, 706-721-1852. We look forward to, again, you making that information not only available to all of our partners and stakeholders, but we encourage our citizens to avail themselves of that tremendous resource that we have in our community. I want to now shift as we come to the point in time where we are about to wrap up. We've talked about the issues related to the safety and efficacy of the vaccine. Thank you so much for your wonderful insight into that. We've also posed the questions around fears, frustrations, and concerns about getting the vaccine, particularly in communities of color with previous experiments. And you have certainly been helpful with regards to that. I think it's important for us to begin framing clear and consistent messaging in our own community and certainly in the region that would help individuals. I like what you said a moment ago, Dr. Bertraud, that if it was by any means necessary, get the vaccine as opposed to doing nothing. That would be one of the messages that we share with people. And so to that end, I want to wrap up with these quick questions and say the following, that as we look at where we are in the state of Georgia, in Augusta, and certainly in America, having the vaccine today does not mean we stop being careful. We have to continue to do the 3 W's. We must wear a mask. We must be vigilant about that. We must wash our hands, and we must continue to physically distance when we're in groups here in the community and beyond. Those things are vitally important to us if we're going to have a safe and a resilient community on the other side of this pandemic. Secondly, the data is still coming in about the vaccine, but what we have heard tonight gives us greater confidence than where we were perhaps days ago or weeks ago about the 2 vaccines that are likely going to be made available to the general public. And we will continue to take input from members of our community, not only our healthcare community as well, about this, that as more information is made available to us, our goal is to hopefully have clear and concise information that allows us to empower, to inform and educate our public. And so with that, I would like to pose this final question, and that is, as the vaccine is made available, what is the immediate message that we should be telling not only our healthcare workers, our first responders, our school teachers, those in our local churches? What message should we be sharing with them about the COVID-19 vaccines and what we as communities of color, communities in general, should do as it relates to our next steps? What should we be telling people?
We should tell them, educate yourself first so you can make an informed decision. Talk to people that you trust and people you believe are knowledgeable about the vaccine. That would be my message.
I would like to say the same. And also, if you are eligible under emergency use authorization, please do it, over prioritizing over flu vaccine.
And I concur. I would stress to people, stay off of social media as your main source of information. There's a lot of misinformation on social media. So I would strongly recommend for the community people to speak with your personal physicians and utilize the CDC and those reputable medias for getting accurate information. And I just want to say, for those who do have children, because the COVID vaccine as of date is recommended for 18 years old and older, I strongly recommend for your children to receive the flu vaccine and continue on with wearing your mask, washing your hands, social distancing until the vaccine is recommended for that age group less than 18. So please, please, please get your children vaccinated for influenza until we're able to, get the COVID vaccine for them.
Yeah.
I would also thank you, Mayor, for what you're doing by keeping the leaders and the community abreast of what's going on. You brought us to the table at the onset so that there won't be any questions down the line. And we should remember that we have a next super spreader event coming up with Christmas, and we should practice all the universal precautions that has been mentioned here tonight. And Mayor, I think the fact that you've been reaching out to leaders in the community, doctors, politicians, clergy, people who the community trusts, that I will continue to emphasize that you continue to do that, because I know that the community tends to trust local leaders much more than they do Washington, D.C.
Thank you for that, Dr. Brown. Dr. Singh, Dr. Davis, Dr. Bertrode, you have been incredible panelists on tonight. I certainly look forward to the next engagement that we will have around COVID-19, and more importantly, how we navigate communities like Augusta and the surrounding region forward to a place of some sense of normalcy as we step into 2021 at the close of this year. So once again, on behalf of the entire city of Augusta, thank you so much for your time on this evening, and I really appreciate it, and I look forward to engaging sometime soon. Thank you.
So we thank you for making me a part of this conversation.
Yeah. Can I say one more thing?
Certainly.
Yeah. So I would like to say that yes, there are 2 vaccines going to be under EUA authorization, but this may not be available to all the people. The dosages may be limited and all other things. So Dr. Bato mentioned that 10% participated in Pfizer and some 13% participated in Moderna. There are still clinical trials going on. These 2 vaccines will not be enough. If good, if there is a site where clinical trial is going on, get the information, get informed, and make an informed decision. That may get you, if you don't qualify under EUA, that is a better chance to get the vaccine over there, because the participants who were in the placebo group in these 2 vaccines trials, they will get crossover to the vaccine group. So the clinical trials are the reason why everybody is getting vaccines. So don't stay away, get that information from the clinical trial sites and participate. Thank you.
Wonderful. Again, thank you, each of you tonight, for your time. And on behalf, again, of our city, thank you for engaging us and informing us on tonight.
Thank you.
Good evening.
Thank you.